Dr. Carol Mathews, welcome to Shrink Wrap Radio.
Thank you. Thanks for inviting me. I'm happy to be here.
Well, I'm really happy to speak with you because you've got such an interesting topic, I think. We're going to be discussing your book, Recognizing and Treating Hoarding Disorder. How much is too much? I like that subtitle, and I'm sure we'll get into that. How much is too much? How did you come to write a book about hoarding?
Well, it's an interesting story. I started my career studying obsessive compulsive disorder and Tourette syndrome, and in particularly the genetic causes of those disorders. And in the context of my clinical practice, I started taking care of patients with hoarding disorder. And at the time it was categorized as a subtype of obsessive compulsive disorder, but it didn't feel the same as OCD. It felt very different in terms of how people presented and what their treatment response was. So I started doing research in hoarding disorder, and specifically in the differences between hoarding disorder and OCD. And about 2 years ago, an editor from W.W. Norton and Company reached out to me and told me that she thought there was a need for a book specifically for the lay press and for practitioners in the lay press in this area. So I thought about it for a while and thought, sure, it sounded like an interesting idea. And I had spent a fair amount of my clinical and research career in this field. So the time is right.
Yeah, definitely. So we probably should start off with some kind of definition of what we're talking about as hoarding disorder.
Sure. Hoarding disorder is a neuropsychiatric illness. It's very biologically driven. It's caused, as far as we know, by genetic factors interacting with other environmental contributors. It affects about 2 to 4% of the population, but it's much more common in older adults. So when you get to age 55, it's about 6% of the population. And when you get to 70, it's somewhere over 7% of the population. It is, go ahead.
I'm sorry, was the last figure 70%?
7%, 7 to 8%.
7 to 8%.
So unlike most psychiatric disorders, it increases in prevalence with every decade of life after about 30 to 40, which is very unusual. Most psychiatric disorders the prevalence is stable across the lifespan, but for hoarding disorder, it increases in prevalence with age.
Do we have any suspicions about why that would be?
Well, I have hypotheses. I'm not sure, and that's one of the things that my lab is interested in testing, but we're quite interested in how people with hoarding disorder process information. And one of the things that we think is that information processing deficits that are stable across the lifespan may interact with some of the things that happen as we get older, are something called decreased cognitive reserve, where our memory becomes a little bit shakier, our attention becomes a little bit shakier. And hoarding symptoms may actually be an expression of these interactions between age-related effects and stable effects. Yeah. Don't know the answer if that's true, but that's something we're quite interested in looking at.
Yeah, I have noticed among my older friends, I'm trying to think, does this apply to myself or not? But I have seen, something that could move in the direction of hoarding. Now, I don't know if it's extreme enough to be called hoarding. As a matter of fact, how do you make that decision of whether the accumulation of objects in one's home is in fact hoarding or just kind of in the normal zone?
That's a great question. So hoarding disorder is actually defined not by clutter, although that's a side effect or a symptom, and it is in the definition as a contributing factor. It's defined by actual difficulty in discarding unneeded objects or excessive objects. And the difficulty in discarding is due to either indecision about whether you should discard it or not, or discomfort in discarding an object. That leads to clutter, which then causes functional impairment because of workspaces being unusable, living spaces being uninhabitable. But the primary feature of hoarding is difficulty in discarding items. It's not really in the accumulation, which is kind of a symptom or a side effect. You might think about it as pneumonia being caused by a bacteria, and the symptom of pneumonia is a fever and a cough.
Yeah, that's fascinating because I don't think I would have thought of it that way. I doubt that most people think that it's a problem with discarding rather than acquisition?
Acquisition is a common feature of hoarding, but it's not a requirement of the diagnosis. About 80% of people do have acquisition, but it is not universal. And it is possibly a separate subtype of hoarding disorder. It's, again, not entirely clear whether if you have acquisition or you don't have acquisition. We all have passive acquisition with mail coming into our homes, packages, containers, clothing. And so the question is, can you discard the things you don't need rather than do you excessively acquire? Although, like you said, acquisition is a specifier for hoarding disorder, and a good proportion of people do have that.
I wonder if the existence of Amazon and other services like that has had any impact on increasing the frequency, because it's so easy to get stuff now.
Well, it certainly seems to have increased the frequency of impairment, because it's much easier to get into financial trouble by buying things. It's much easier to obtain things. So yes, I think it does. I don't think it increases the prevalence of hoarding disorder itself, but I think for those who are prone to it, it definitely increases the risk of functional impairment or lack of control resulting from it.
Yeah. Wow. Wow. When did it become officially recognized as a disorder?
So the Diagnostic and Statistical Manual, the psychiatric manual that lists the psychiatric disorders that are recognized officially, included hoarding disorder in 2013. So it's been less than 10 years that it's been officially recognized. Randy Frost and Gail Steketee and their colleagues, prominent researchers in the field of hoarding disorder, recognized this as an individual syndrome decades earlier than that, but it really only came to formal recognition in 2013.
Well, I imagine that the phenomenon existed going historically, maybe going way back. How did folks regard it in olden times?
So yeah, it existed. It's been documented as far back as Dante, who talks about hoarding and keeping in his writings. It depends on how far back you go. Originally, hoarding was thought of as you think, as excessive accumulation and keeping, and usually of valuable things. But as people started to recognize this more pathological form of hoarding, where people were keeping unneeded things and garbage, and clutter was really becoming a problem, it was really considered to be an eccentricity, a habit, something that was in one's control. It was not thought of as an illness. That's the case with many psychiatric symptoms. However, it's not unique to hoarding. It's one of the things that happens before it's recognized as an illness.
Now, I notice in terms of the diagnostic category, it moved from OCPD to OCD, and so kind of a move from personality disorder, it sounds like, to what and why?
To a psychiatric illness. So that kind of goes along with the idea that personality disorders are, of course, also psychiatric illnesses, but most people think of personality disorders as essentially being more in one's control. They're not. But yes, it has moved in placement over time from a bad habit or an eccentricity to a personality trait to an actual primary psychiatric illness, or a component of a psychiatric illness, and now to its own individual psychiatric illness.
Okay, going back to the historical look, perhaps I know in your book you refer to some fairly famous examples from the past. I wonder if you could share one with us.
So there are a number of them. I think probably the most famous that I talk about are the Collier Brothers, who were two brothers who lived in Brooklyn in, I think, the 1930s. Who were very eccentric in lots of ways, but lived in a brownstone and were very isolated. One of them was blind and had a number of physical illnesses, and the other cared for him. And over the years, they became known for numbers and numbers of eccentricities, keeping everything that they could get their hands on, going out and roaming the streets to identify things to pick up. And they were eventually found, one after another, buried in tons and tons and tons of clutter and accumulated objects, including things from their father's gynecologic practice, pickled organs from his gynecologic practice, mounds and mounds of garbage. They had set tripwires and booby traps within their home because they were worried about intruders, because there were also things of value in their home. And I think that's one of the things that is really characteristic of hoarding, is that the difficulty discarding or the need to keep an item is irrespective of somebody else's assessment of the value. Value is a more individual decision on that person's part. And so it's not that somebody with hoarding disorder keeps only things of high value that are objectively valuable to society. They keep things that are of value to themselves.
So, okay. So do they tend to have a strong sense of the value? I mean, is that part of the resistance to discarding things? Is this stuff is valuable to me, I don't want to let go of it?
Sometimes it's also that it could be valuable to them or to someone else. One of the people that I took care of years ago in California lived through the Depression and also lived through the Dust Bowl. And he kept and acquired things. He had 15 school buses on his property, and his porch was just covered such that there was only a little walkway. And he would periodically collect those objects and send them to family members, thinking that the family members were in need and would value those items. So it wasn't that he personally valued them, but somebody might need them.
Uh-huh. And of course, we all think, we sometimes regret things that we've thrown away because with time they do get valuable.
Right. Or we might have needed them. It's information hoarding is a very common one. I don't want to throw away a piece of newspaper or an email because I may need that in the future and not be able to find it again.
Oh boy, that's a whole nother dimension. I mean, I think we all struggle with our computers in terms of, should I throw this away or not? And I might someday need it. And how big a hard drive do I need? And how many hard drives do I need?
Right.
These are existential
hoarding
questions these days.
Information hoarding is a new area of interest in research because impairment is a little more difficult to assess, but you're right, it's more and more common to keep more and more hard drives and to not discard emails or other things. It's harder to quantify clutter in that context, but I have seen cases where information hoarding is clearly impairing, where multiple computers are needed and people don't have the money to buy the multiple computers and hard drives that they feel are necessary, for example.
Wow. Going back to historical examples, there's another one that you referred to, who was the Greek Diogenes. And I thought that was particularly interesting. Tell us about Diogenes.
Right. So Diogenes is interesting because I would not argue that he had a hoarding problem. He actually eschewed material goods and lived in a ceramic pot in the Greek marketplace.
That's
but
the part that really snagged me, was living in a ceramic pot.
Right. But he was also unusual, and he characterized some of the things that were in the 1950s and 60s and 70s thought to be a part of this syndrome. So Diogenes syndrome is an older term for hoarding disorder. And what he embodied was probably more of the disheveled nature, the lack of self-care that can come along with hoarding behaviors in the context of dementia. So not hoarding disorder itself specifically, but hoarding in the earlier days of scientific explanations around it were seen most commonly in the context of either dementia or psychotic disorders. And Diogenes syndrome really embodied some of that lack of self-care. And the hoarding kind of came along part and parcel of that. So he was not, in my opinion, he did not have hoarding. The name is a little bit of a misnomer.
People who do have hoarding, are they aware that they have a disorder? A problem?
Many people are aware that they have a problem. They may not be aware that they have a disorder. In fact, a study that we have done asking 20,000 people about hoarding symptoms has identified of the 6% that we identify as having hoarding symptoms, only 40 of them have had a diagnosis of a disorder. So because it's such a new diagnosis, many people don't know that they have a disorder. That's not to say that they don't know they have a problem. Many people do know that they have a problem with hoarding. There are people who do not recognize it, people who have very poor insight into their symptoms, and some people who are delusional, although that's less common.
Well, let's go back to the subtitle of your book, How Much is Too Much? Because there could be people in our audience who are squirming maybe, and who are asking themselves that question. How does one self-diagnose?
So what I would say is a couple of things. One of the things that we've done in our research is to ask a question. And this question, if you only had to pick one question, is probably the most diagnostic of a hoarding problem, which is, are you embarrassed or reluctant to let people into your home because you're embarrassed about the amount of clutter in it? That actually is pretty diagnostic of a hoarding problem. I think for me, the more telling questions are, can you use the aspects of your home in the way that they're intended to be used? Can you sleep on your bed, or do you have clutter on your bed? Can you use your couch? Can you use your stove as it was intended to be used, or are there things piled on it such that it's not safe to use? Can you use your dining room table? Those to me are more practical aspects of how you think about hoarding disorder, because everybody has some level of clutter. Many of us have a garage or a study that we call our junk rooms, and that is not hoarding disorder, right? Can you use your rooms and your objects in the way that they were intended to be used?
Yeah.
Can somebody fit in the front seat of your car or not? That's a more extreme version. Most people don't bring their clutter into their cars, but some do.
Wow. Wow. Yeah, I have a neighbor who from the outside, I would say that they maybe have a disorder. When I rarely go into their house, it's and particularly in their yard, there's just stuff everywhere, and you kind of have to weave a path through it. But they don't seem distressed at all about that
Well,
situation, and she's unembarrassed. I mean, yeah, come over, come on into the house.
So some people don't have as much insight as others. Some do, would be reluctant to let you into the home, have some awareness that it's a problem. Some have something that I would call clutter blindness, which is—
I was going to ask you about that next.
Yeah, clutter blindness or room blindness is a really interesting phenomenon that really speaks to, after you have gotten used to your space, you forget what it looks like. And if there's a room that's full that you haven't used in years because it's full, if you're asked to draw a schematic of your house, you may leave that room out. You may forget that it even exists. If you're asked to draw a schematic of a room that's got clutter in it, you may draw it as a much smaller room than it really is, because you don't see the clutter as clutter. You kind of, in your brain, turn them into walls. And so you'll draw the usable living space rather than the actual space. So there is this phenomenon. We all get used to what our own living space looks and feels and smells like. And this is a more extreme version of that. If that same person, though, walked into another person's home who had a hoarding problem, they would recognize the hoarding problem. It's really very specific to one's own home and materials.
Yeah, fascinating. I never would have guessed, that this could be such a fruitful area of research with all these ways that you've discovered to slice and dice it. You talk about something called churning. Tell us about that.
Right. So churning is these are symptoms of hoarding disorder that are not in the diagnostic criteria, but are nevertheless very characteristic. And churning is where you would repeatedly pick up items and think about doing something with them, but really not effectively sort or discard or process them. We all churn when we're anxious. We may do something that's not particularly efficient in our homes, but churning is somebody with hoarding disorders attempt to manage the materials without actually effectively managing it.
I'm thinking of this woman, Marie Kondo, is that her name?
Marie Kondo, right. Mm-hmm.
Yeah, who's been
She's very,
pardon?
She's the opposite. Yeah.
Yeah, the opposite. I was going to say, where does she fit into the picture and the people who read her books and need those sorts of services?
So it's interesting. I have had a few of my hoarding patients read her books, and at least in her initial book, her argument was, take an object and really spend some time with it and think about whether it brings you joy. And if it doesn't bring you joy, eliminate it. And with a hoarding participant or with somebody who has hoarding problems, that's a very difficult assessment, because many of the things that they keep for sentimental reasons. That's not the only reason, but that's one of the express reasons. If I don't keep this napkin from my daughter's 4th birthday party, I may never remember that birthday party. So it may bring joy in that level, but there is no ability to value, or little ability to value, the napkin from the photo. Most of us would keep the photo and discard the napkin, but for many people with hoarding disorder, those two things are valued equally. So valuation is a very different phenomenon. And so for Marie Kondo, for most of us, it's a very efficient way of looking at, do I need that shirt or do I not want that shirt? But for somebody with a hoarding problem, it's not an easy question.
Do you have formal ways of assessing the disorder? Are there a list of criteria? Do you have paper and pencil inventories? Tell us about that.
We do. There are basic diagnostic criteria that the Diagnostic and Statistical Manual lays out. The key of them, the key one is difficulty in discarding and the associated indecision and impairment. There are question and answer, paper and pencil question and answer things that you can fill out. Many of them are available actually online. There are also clinical interviews that that clinicians can give to a patient in whom they're concerned about. There are many aspects of these. Some of the better known ones are the hoarding rating scale, which is a 5-item questionnaire. And we've spent some time determining what the cutoff criteria for that is to decide whether you have hoarding or don't have hoarding. Clinical assessment is still the gold standard, actually, because you really need to ask in detail about what impact it has on your life. And the paper and pencil questionnaires are a little bit harder at getting at that, but they're not bad.
You mentioned the 5 scales. What are the 5 dimensions that you?
So the 5 dimensions of the hoarding rating scale are difficulty discarding, excessive acquisition, excessive clutter, distress associated with those symptoms, and impairment associated with those symptoms. The problem with those rating scales is that they're a little bit non-specific. You can score very high on those items if your spouse has hoarding disorder, for example, because you would have impairment from clutter. You might have difficulty discarding because they might not let you throw it away. But in general, they're very good, at least screening assessments for these disorders.
What about comorbidity, a term that we tend to use when people have more than one disorder in a cluster, let's say?
Right. So hoarding disorder is one of those disorders, particularly because it affects people throughout the lifespan, where there are a number of psychiatric co-occurring conditions. The one that is the most frequently talked about is obsessive compulsive disorder. And as I mentioned, hoarding used to be considered a subtype of OCD, but actually OCD only co-occurs with hoarding in about 20% of cases. The number one co-occurring psychiatric illness with hoarding is depression, major depression. 50% of people with hoarding will have major depression at some time in their lives. And another 30 to 40%, perhaps more, will have an anxiety disorder. So those two, depression and anxiety disorders, are very high in hoarding.
What about children? You said it's a disorder of later life, but does it occur at all in children?
Well, that's an interesting question. The average age of onset for hoarding disorder in retrospective studies is about 14 or 15. So teenagers clearly have symptoms, but they don't start to have problems. So symptoms and problems I would like to differentiate. They begin to have evidence or symptoms of hoarding disorder in their teens. The problems only begin in the 30s or the 40s or the 50s, and hence this increasing rate of hoarding as you get older. When you get to younger children, we do see hoarding in younger children, but we rarely see pure hoarding. What we will typically see is hoarding in the context of obsessive compulsive disorder. You can still see hoarding as a symptom of OCD, hoarding in the context of ADHD or autism, or actually hoarding in the context of abuse or neglect. That's another one where we see children hoarding materials. And as a psychiatrist who treats children, if I hear that there's hoarding, and particularly hoarding of food or unusual kinds of objects, trauma is something I would look for.
Really? Trauma?
But hoarding is quite rare in children, just all told. It's much rarer in children than it is in adults.
Yeah. cat ladies are a particularly well-known phenomenon, I think. I've known at least one cat lady in my life, maybe others. What about the hoarding of, I gather it's not restricted to cats and maybe not even to women. Tell us about
Correct.
animal hoarding.
So animal hoarding is something that is much less understood, and it's because most people who really have animal hoarding probably have a form of a delusional disorder and are not aware that they have a problem. And I want to distinguish animal hoarding from people who have a lot of animals. So there are a lot of people with multiple cats or multiple dogs or multiple horses, more than we would think to be normal. But animal hoarding is, what happens in animal hoarding is people actively acquire animals in order to save them. They will go out and rescue animals from the street. They will collect animals from rescue shelters, but they are not able to care for those animals. And they are not able to see, even with evidence in front of them, that they're not caring for those animals. So it is a fundamentally different type of a disorder, a much more severe disorder. And folks who really have animal hoarding, in contrast to those who just have a lot of animals, so it is a different phenomenon, tend to run from treatment. They don't recognize that they have a problem. And veterinarians and law enforcement, code enforcement, are the people who tend to identify animal hoarding as a problem. And it has been more litigated in the past than treated, although that is starting to change.
Yeah.
And the fundamental characteristic of animal hoarding is the lack of insight into the damage and the inadvertent damage that's been caused to the animals because of the lack of ability to care for them.
Yeah, well.
Many people with animal hoarding also have other kinds of traditional hoarding, and that's why we think of it as a similar related disorder, but it's probably a very extreme form of the disorder.
You mentioned that hoarding is a neuropsychiatric disorder. I think that's what you said in the beginning. What can you tell us about the, I guess, the brain of people who hoard?
So what we know about the brains of people who hoard is that there are some subtle differences in information processing and cognition. Our studies have looked at neuropsychological profiles, have looked at electrophysiological EEG measures of hoarding, and we've also started to do neuroimaging, brain imaging studies using MRI, et cetera. And what those studies have found is that people with hoarding disorder are as intelligent as anyone else, as competent as anyone else, but they have very subtle differences in how they process information, and in particularly how they process errors. So you and I, if we were pushing a button and we were asked to push an X instead of a Y, would know that we made that mistake, would correct that mistake, and our brains would register that mistake in a particular way. People who have hoarding disorder don't make any more mistakes any more frequently than we do. They recognize the mistake and they correct the mistake just like everybody else does, but their brain does not register it in the same way. They have a dampened system for monitoring those errors.
Huh.
So their error recognition system is not fully online. And that leads us to think that maybe if you're can't ever be sure if you've made an error or not, maybe you don't want to throw anything away, because what if you have made a mistake? So it's this disconnect between what they're actually doing and how their brain is registering it. We've also seen that people who have hoarding disorder have very inefficient visual processing in using EEG and MRI studies. So their visual system works fine, they see fine, but their higher order brain doesn't process the visual information as efficiently. And that again may explain why people with hoarding like to keep things out in front of them so that they can see where everything is. It's a common symptom that someone will tell me, well, I have to have everything visible, otherwise I can't find it. And that may be because their visual processing system is not efficient.
That sounds
These
like
are early days of these studies, but there is emerging evidence to suggest that both of those are the case.
And it sounds like it might relate to the clutter blindness that you were speaking about earlier.
I don't know if it does or not, but that's certainly an interesting hypothesis that we're interested in, is if you are inefficient in your visual processing. Again, vision is not impaired. People with hoarding disorder see just as well as anyone else. It's how they process that information. They may more easily forget about rooms that are present or see things differently. That's right. And we don't know. That has not been investigated.
Yeah.
The underpinnings of clutter blindness have not been studied.
And I remember you mentioning at the beginning that there's a large genetic component. What can you tell us about that?
So hoarding disorder is about 50% genetic, meaning that 50% of the contribution to the development of hoarding disorder is genetic. We think about hoarding just like we think about all psychiatric disorders. It's not that you have a gene and you're going to get the disorder if you have the gene. It's not like cystic fibrosis or Huntington's disorder. It's more of a susceptibility. If you have a genetic loading, you're more likely to get hoarding disorder, the same way you would be for diabetes. If you have a genetic predisposition and you have this diet, you're more likely to get diabetes. So about 50% of the contribution to hoarding disorder is genetic, and the other 50% is environmental. And whether that's trauma at birth or trauma in daily life or toxins, we don't know. We know that there's an environmental component that is as important as the genetic component, but what those environmental components are, we don't know.
Have you identified specific genes associated with the vulnerability, or is it more from longitudinal family studies?
So we have not identified specific genes associated with hoarding disorder. And in fact, that area of research is very far behind, because in order to do those studies, you need tens of thousands of people to participate. That's a study I'm working on right now, is collecting participants with hoarding disorder to do those studies. But the way to think about it is that it's not genes that turn on hoarding or don't turn on hoarding, it's an additive effect. So the more genes you have that contribute to hoarding, you hit a threshold. And so we are unlikely to identify single genes that cause hoarding in any time in the near future. What we are likely to be able to do is to identify a propensity, a genetic propensity towards hoarding. And those are the kinds of studies that I'm interested in doing.
Okay. Well, when it comes to treatment, are there any drugs that seem to be helpful?
So there are medications that can be helpful. The primary treatment for hoarding is actually psychotherapy, and an evidence-based form of psychotherapy. But some of the antidepressants can be helpful. Not all of them, but some of them. Very, very few studies have been done. But some of the serotonin reuptake inhibitors have shown some promise. Some of the newer agents like duloxetine and venlafaxine have shown some promise. Some people have looked at using ADHD medications to treat hoarding. That's not clear whether it makes much of a difference, although there is an ADHD-like component to the executive functioning problems I was talking about, and it may treat those. But for the most part, the mainstay of treatment for hoarding disorder is cognitive behavioral therapy, and specifically focused on hoarding disorder itself, in practicing discarding items.
Interesting. So practice. Yeah, tell us as much as you can about that approach.
So we've studied, and others have studied, behavioral treatments for hoarding, and the most effective approach right now appears to be a form of treatment that's very useful in obsessive compulsive disorder, other anxiety disorders, and mood disorders, which is understanding the distorted thoughts that are associated with why you keep something, and then practicing discarding. So when I treat a patient with hoarding disorder, one of them has an assignment this week of throwing out 3 shopping bags full of unneeded items every day and sending me an email to say that she's done it. So accountability is an important piece of it. Having somebody help you, at least provide encouragement, is an important piece.
Yeah.
But really just practicing discarding things, limiting the things that come into your home is another important component. And actually peer support is the number one thing that we have found that helps with the people who do well are people who have support from a family member or a peer, who call to check in, to hold them accountable, to help encourage them. The other thing that helps with treatment of hoarding disorder is cognitive rehabilitation, which is helping with those executive functions, the attention, the memory, the organizational things that we found to be inefficient in hoarding disorder. So doing this practicing discarding and adding in some specific things to help people with memory and organization and structure is also very effective.
Yeah, yeah. What, how long is the average course of treatment, and is there a sense of cure, or is it always kind of there at some level?
Yeah, that's a great question. So the average treatments are somewhere between 16 and 20 sessions. I find that many patients need 2 sessions back to back. Not everyone does, so probably 40 sessions. So almost a year's worth of weekly treatments, if you want to think about it that way, to really be effective. Some people do quite well with less than that. But just like all psychiatric illnesses, there isn't a cure for this disease. There is treatment for it and management of it. But for most people, there's not a cure. Some people do very well and essentially go into remission, but many people struggle with, if not the clutter, the urges to collect things or the urges to hold on to things for most of their lives.
Yeah, yeah, which makes it sound like OCD, right? That,
Mhm.
'cause I know that happens there.
Right.
Are there self-help options?
There are some self-help options. Many of them, the internet-based self-help options that used to exist are no longer clearly available, but there are some still. There's a self-help book by a colleague of mine, Lee Schuer, who suffers from hoarding disorder himself, and he's developed a book called Buried in Treasures. He and some of the scientists who have done the research on this.
What was the title again?
It's called Buried in Treasures.
Buried in Treasure. Okay.
Right. And it's less effective if you do it by yourself than if you do it with a group or with somebody helping you, but it can be of help. There are Alcoholics Anonymous type groups, Hoarding Anonymous, they can be of help. There are some online self-help groups, or have been in the past. They're a little bit harder to find. Again, that peer accountability seems to be the #1 factor in the utility of those approaches.
Yeah. So what's the impact of all of this on family and friends? I could imagine that it might kind of drive them nuts. Saying, why are
Well,
you doing this?
yeah, there's a profound impact on family and friends. And I think the biggest impact is the fact that most people really don't know that this is an illness, right? They see this as a choice, and it's not a choice, it's an illness. And so your question is right. Why are you doing this? Why can't you throw this away? Why are you cluttering our home, etc.? It has, for people who are severely affected, it has very profound impacts. 25% of deaths by house fire are caused by hoarding. 8% of children and adults removed from the home are removed for hoarding related reasons, either because the individual themselves is at risk for a fall, or a child or an older person in the home is at risk. Kids who live in a hoarding household may not have a place to do their homework. They may not have the ability to invite friends over. This is for severe hoarding symptoms, right? Milder hoarding has an impact in family discord and marital discord for sure. But what I'm talking about in the context of house fires, et cetera, is the more severe form.
Yeah, yeah. So
but it has a very profound impact.
It sounds like there's a real need for public education. For a more
there is, because
awareness.
It's a treatable disorder, right?
Yeah. And so I'm tempted to ask you, what are you doing along those lines? But of course, you're being on a podcast. And that's a good thing to
book,
do.
Right, right. Yeah. Actually, the reason that I wrote the book was really for that reason, which was to decrease stigma and increase awareness. When I found that of the 20,000 people that we gave this hoarding questionnaire to, 2,000 or 3,000 of whom had clinically significant hoarding symptoms, but only 40 of them knew that they had hoarding. That was really profound for me, that their doctors don't know it, they don't know it, their family members don't know it. There have been television reality shows about hoarding. I'm sure that your listeners will have heard of some of these, Children of Hoarders, reality shows where they will show us somebody with severe hoarding and they'll have a therapist go in and do a forced clean out. Those are not the kind of awareness that I want. They have a raised awareness of the disorder, but they're not the kind of awareness that I want. What I want people to know is that this is a psychiatric illness. This is not a choice. It's like obsessive compulsive disorder or depression. It's an illness with a biological cause that can be treated. And the choice is therefore not to have hoarding disorder or not have hoarding disorder, but to get treated for it, which is a problem.
Is there anything else that you'd like to get out there before we close?
Well, I would like to say that as a psychiatric illness, people who suffer from hoarding disorder do get discriminated against by landlords and tenants, by employers at times. And as an illness, there is an Americans with Disability Act clause that allows for assistance for people who are struggling with these symptoms and who are at risk for losing homes. We've seen more evictions recently in the time of the COVID crisis, for example, and people with hoarding are discriminated against in general in those kinds of evictions. And there is help available for that as well. I think that's important to know.
Well, this has been a fascinating interview. Dr. Carol Mathews, I really want to thank you for being my guest today on Shrink Wrap Radio.
Thank you very much. I've had fun.